last did you touch your breast? Let me rephrase the question. Do you even know how to examine your breasts? You don't. Let me teach you.
Oh, you think because you're a man, this does not affect you? It affects you, okay? So stay tuned.
Let's start off easy. When should you examine your breast? It should be between 5 days to 7 days after your period ends. Do you know that it's important for you to be familiar with your breast? This way, you can easily detect when there is an anomaly or any changes and report it ASAP.
Okay.
So, where do you do it? Okay, that sounded somehow, but yeah, where do you examine your breast? You can do it in your room, in your house, in the shower, because the lather from the soap helps your hands to glide over the breast easier. So naturally, your next question would be, how do I examine my breast? Let me bring you up to speed. First thing you need to get is a mirror. Why do we need a mirror? Well, you can't exactly see your breast properly from above, can you? That's just an angle. So we're going to need to assess the reflection of the girls in the mirror. So let's get into the breast examination proper right now. You're going to stand or sit erect in front of your mirror. You are my mirror for today. So you're going to be doing that without a shirt or a bra. For obvious reasons, I can't be unclad right now, but I hope you can follow me. Stand with your hands to your side as I am doing. I hope you are standing up and you're trying this now. I hope so. You're going to stand in front of the mirror with your hands to your side and you're going to look at your breast. Admire it. Look at it. Observe the differences in size, because that can happen. The differences in size. What does it look like? Are you seeing any skin pulling together? We're trying to see if there is any dimpling. Is the skin on your breast looking like orange peel? You know what orange peel looks like? Yes. Is that happening? Is your nipple inverted? That is it pointing inside? Is it not coming outside? Is it not facing the world? Yeah. Also, if there is any contour or changes in the normal appearance that you're used to, which is why you need to do this often so that you are familiar with what your normal appearance is. Now place your hands over your hips and also admire. I say admire. Has there been any changes due to the extension, right, along this area? So you're going to do that and observe if there are any changes in the mirror. If you observe changes in the size of your breast, right, this is a normal variation. It happens. A part of the body might be slightly bigger than the other one. But this is why you need to be more familiar with your body so you know how it was before. So if you're seeing something that looks suspiciously different, you can quickly identify that. Let's get back. So you put your hands on your hips and you look into the mirror. The next thing I'm going to need you to do now is the palpation proper. You're going to position your hands like this and you're going to be palpating with this side of your fingers, the palm of your fingers, right? And you're going to lift one hand over your head, behind your head. Now let's start. We're going to start from here. Yes, practically inside your armpit. And this part of the breast is called the tail of Spence, right? And it inserts into the axilla area. Now, this part is commonly ignored, but studies have shown that both non-cancerous and cancerous lumps have been found in this part of the breast as well. So yeah, we're not neglecting that. Now, the methods to palpate the breast. We have the up and down method. So you're going systematically from one side of the breast to the end. So basically from the inner corner to the outer corner of your breast, you're going to be going up, down, up, down, up, down, up, down, up, down. The next one is for you to be going in a circular motion. So let's say you start from here and then you start palpating like this, like this, like this, and you reduce the circle till you reach the center towards your nipple. And then the next option is for you to palpate. This one is called wedge style. So you're going to palpating from angles like this to the nipple, 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 like this to the nipple. Do you understand? But for the purpose of this video, I am going to be explaining the circular motion. The main event. So we're going to be beginning from the tail of Spence and you're going to be palpating that, right? Press onto it properly. Press onto it properly, like with some strength and depth into the palpation. So we're doing that. I don't know why I'm laughing, it's not funny, but this is what we should be doing, right? You can see that my hands are coming closer towards the center of my breast, or rather towards the nipple area of my breast. Basically, till you get to the nipple, you get the gist. Now when you get to the nipple, when you're done palpating, you can squeeze that out and see if there is change in the texture of the nipple, and also if there is discharge, because that can be a cause for a little bit of alarm, especially if you are not breastfeeding. Voila, we are done with class, and I hope you practice this at home. I hope you do. When did we say we should be doing this? Every 5 to 7 days after your period. Some people would say you should do it the same day every month, but in case your periods are irregular, right, just do it every 5 to 7 days, 1 week after your period ends. Check from time to time. Now, if you detect any changes, you would need to take some more examinations, do you understand, so that they can have definitive diagnosis for the condition. Remember, early detection helps and it improves health outcomes. It's been your favorite nurse, and you're welcome.